Hi, I'm Peggy Krause, and we're going to talk today about how to interpret your lab report. I've had a lot of practice at this. I have been in cardiac rehab now for 25 years, and I'm a certified diabetes care and education specialist, so I've seen a lot of lab reports. And I've been with Wellness Foundation now for more than 10 years, and I have helped many people, probably thousands of people, to lower their cholesterol and their A1C, their blood sugar numbers, and help them on their way to feeling a lot better, a lot healthier, and happier. So let's get started. Okay, so what tests should you expect that your doctor would run? I would say that minimum, they would probably run a cholesterol panel and a comprehensive metabolic panel and an A1C if you are overweight or have a history of high blood glucose. So the lipid panel is what's going to give you cholesterol numbers. The comprehensive metabolic panel, that is going to give you your fasting glucose. And again, the A1C will give you an average of your blood glucose numbers over the last 3 months. And we'll talk about that a little bit as we go on. So other tests that you may ask to have your doctor run for you are B12, vitamin D, and also a thyroid panel. So we're not going to talk about those three really, but vitamin B12 will let your doctor know, will let you know if you are adequate in vitamin B12. Remember, that is a bacteria-borne vitamin, so it comes from primarily animal foods. It's bacteria-borne, so when there's bacteria on chicken or beef or in eggs, those bacteria make vitamin B12. But if you're not eating those things, you need to get your vitamin B12 elsewhere, and supplements are readily available to help you with that. Vitamin D, because we don't get adequate sunlight, our body does make vitamin D, and it's not really a vitamin per se, but vitamin D is a hormone, and you're going to want to make sure that you have enough of that. So those two vitamin hormones you might request if your doctor doesn't already order them. And again, your thyroid panel, I should say lastly, your thyroid panel can tell your doctor if your thyroid gland is working optimally. So that's all I'm going to say about those three tests. But the lipid panel, the glucose, and the A1C are what we're going to really dig into today. So in the lipid panel, there are usually four measurements. There's the total cholesterol, there's the LDL cholesterol, and there is HDL cholesterol and triglycerides. We're going to go through each of those. We're going to talk about what your doctor wants them to be because he or she is following the national guidelines, and what the research says that they really should be. So let's talk about total cholesterol. So total cholesterol is the sum of several cholesterol particles, and the national guidelines want that total cholesterol number to be 200 or less. Okay, well, let's just say less than 200. Okay, they consider that desirable. Numbers between 200 and 239 are considered borderline, and 240 and above considered high or elevated. Okay, so let's just sort of put that into perspective. So in the Framingham Heart Study, which is a study that's been going on for a long time, okay, and it involves thousands of people, hundreds of thousands of people, they found that 35% of Ischemic heart disease happens in people who have a cholesterol level between 150 and 200. So ischemic heart disease happens when you have a blockage in the coronary arteries and there's ischemia. Ischemia means lack of blood flow in the heart, or lack of blood flow anywhere, but ischemic cardiac disease is lack of blood flow to the heart. So if 35% of people who have this lack of blood flow to the heart have cholesterol levels between 150 and 200, is that really desirable? It's not desirable. If you have desirable cholesterol levels, wouldn't your cholesterol level be in the range where you're not at risk for ischemic heart disease? That to me would be under 150, right? The other little bit of information is that in the CARE study, in the CARE study, the researchers found that the average total cholesterol level in patients who had a heart attack, 209. Now remember, 209 is mildly elevated. But if the average cholesterol of people who have had a heart attack is 209, wouldn't you think that would be sort of like the red flag area instead of elevated? I don't know. Something's going on with these numbers here. If we look at the research, let's go back to that Framingham heart study. Nobody in the Framingham heart study who has a total cholesterol level under 150 has had a heart attack. Plain and simple. So shouldn't that be the level to strive for? Let's not strive for this under 200, because that's going to give you coronary artery disease, right? 35% of people who had ischemic, lack of blood flow to the heart, artery disease, had blood cholesterol, total cholesterol levels between 150 and 200. Much too high a limit. We are giving ourselves a false sense of security by letting our cholesterol be above 150. So we need lower than 150 for a total cholesterol number, and that needs to be sustained. Just because you had lower than 150 3 years ago and now it's higher again, that doesn't mean you have any sort of protection. You need to keep your cholesterol level, total cholesterol level, under 150. Okay, LDL cholesterol. So LDL cholesterol we call the bad cholesterol, or the lousy cholesterol for the L. That's how you can remember it. And in the national guidelines, the LDL cholesterol, as desirable, should be under 100. So LDL cholesterol is a part of that total cholesterol. But LDL cholesterol at that level, under 100, listen to this, almost 75% of heart attack patients fell within the recommended targets for LDL cholesterol. So if the recommended target is under 100, and 75% of people who have a heart attack are in that range, meaning that the other 25% are above that number, right? Shouldn't we really be stringent on LDL cholesterol? Well, again, let's go back to the research. We found that LDL levels of 80 or less is protective, or if you have heart disease, you're going to want that number 70 or lower. The American Heart Association, I've heard, in some instances, wants 60 or less. HDL cholesterol. So this gets a little sticky, because I have heard from many a physician that, oh, don't worry so much about if your total cholesterol is high or if your LDL cholesterol is high. Don't worry about it so much if you have high HDL levels. So let's step back. What does HDL do? So HDL is the good cholesterol. It's the happy cholesterol. And its job is to carry out the LDL cholesterol from the bloodstream, right? So HDL cholesterol knows that LDL cholesterol can easily wind up inside the artery wall and lead to a blockage. So HDL gets to work and it scurries those LDL particles out of the bloodstream. So it sounds like a good thing, right? The more HDL cholesterol that you have, you can get rid of more LDL cholesterol and everything will be fine. Well, there's a problem here. That HDL cholesterol probably works very well in people who are slim, people who have normal blood glucose, normal blood pressure, and are otherwise healthy. The minute somebody becomes overweight, has high blood pressure, has high glucose, is not sleeping well, has high stress levels, plus more, that causes the HDL to be ineffective. And not only is it ineffective, but it actually can be damaging. So a researcher from a 2020 study, his idea or his thoughts were that HDL, those numbers are meaningless. Another one said in disorders such as chronic kidney disease, which most Americans have, at least stage 1 and stage 2, and your doctor's probably not telling you if you have stage 1 or stage 2, so you can put that on your agenda to talk to your doctor about. But in disorders such as chronic kidney disease or cardiovascular disease, which we know by and large all Americans have, it has been observed that HDL is modified and becomes dysfunctional. We know that as soon as there's any inflammation in the body, those HDLs are not working. Okay, so you want to keep those LDLs down. You want to keep the total cholesterol down because that HDL is probably not helping you. Okay. Triglycerides. What in the world are triglycerides? So just simply put, very simply, is that triglycerides are the transportable fat in the bloodstream that can quickly be used for energy. Okay, but when you eat too much, those extra calories are repackaged as triglycerides. They circulate in the blood until they're stored. And they're stored either as fat on the body or fat within tissues where they don't belong, that is insulin resistance. And then eventually you either gain weight or you build cholesterol in your arteries, or you store fat in your muscle tissue, and that elevates your blood sugar. You store fat in your liver, that elevates your liver toxicity. So triglycerides, we want them to be under 150. And because they jump around a lot, remember that the circulating fats in the bloodstream. So with every meal, with everything that you drink that's not water, those triglycerides jump around a little bit. So we just want them under 150, and of course the lower the better. Remember that I said when you eat too much and you have extra calories, they're packaged as triglycerides. So the common or the smart answer there would be just don't eat too much, right? Eat whole foods. Don't eat packaged foods because they contribute to high triglycerides. So borderline high triglycerides, 150 to 199, and then high triglycerides would be 200 to 500, and then above 500 is considered very high. So how does glucose appear on your cholesterol report, on your lab report. So the two numbers that we can talk about. We can talk about the fasting blood glucose. That is a number that is going to be probably somewhere between 65 and, I've seen as high as 500 in somebody who might have type 1 diabetes. But usually it's probably going to be somewhere around 80 and maybe 250. So no diabetes on a fasting glucose. This is fasting, so you haven't eaten for 8 hours. Fasting blood glucose should be below 100. Right? And that too will jump around a little bit depending on what you ate, how much water you had, how much activity you've had, stress, sleep. All those things play tricks on that blood glucose. But when that number is between 100 and 125, that can be diagnosed as pre-diabetes. If that number is 126 or higher, that is full-blown diabetes. Probably when your doctor sees that, if it's in the pre-diabetes range, might not even say anything. But when it starts to encroach on 126, that's when you might hear you're getting too close, you need to watch, and you better start watching because diabetes can sneak up like this. The other glucose test that we have commonly done is the A1C. So A1C is an average. It's the average blood glucose over 3 months' time. And the reason why we call it, why that number is so significant is because when there's a lot of glucose in the bloodstream, it makes the red blood cells sticky. And the more glucose in the bloodstream, the stickier they get. So A1C measures how sticky those red blood cells are. And a normal, what the guidelines say is normal, blood glucose, A1C, would be 5.6 or less. Pre-diabetes would be 5.7 to 6.4, and 6.5 and higher is diabetes. So we use those numbers to sort of categorize people, but it's not an official diagnosis. We can't make, or your doctor can't make, an official diagnosis. According to Medicare, who sets the guideline for a lot of the other insurance companies, it needs to be either a fasting blood glucose, it needs to be an oral glucose tolerance test, or it needs to be a random blood glucose, and they all have their own parameters. But for now, we don't use A1C as a diagnostic, but your doctor can use it to judge whether or not he's going to treat you with medication. I just want to jump back, and I want to go back to that A1C and how that 3-month average comes into play. So those red blood cells, they live for 3 months, give or take, 2 to 3 months they live. So let's say they live 3 months, okay? So the day that you had your blood test on January 1st, your A1C is a certain number, right? And you have right there in that time, in that moment, you have some really old cells that are almost ready to die, and you have some brand spanking new cells. But those cells are equally coated with glucose. Let's go a month from then to February 1st, right? A third of those blood cells will have died off, but you still have 2/3 of those cells are still are still older. So even if you change your diet today, your exercise habits today, it's what'll happen is that it takes a while for all those sticky blood cells to die off. So it's not it doesn't happen that within 3 months you're going to have a whole new set of red blood cells. So I sort of jumped ahead of myself, but so between the cholesterol, the fasting blood sugar, and the A1C, that gives you a pretty good insight into what your health is like and what you can expect down the road. What can a plant-based diet do for you? First of all, a high fiber, low fat diet is going to stop the fat going into your bloodstream, going into your body, right? That contributes to those high cholesterol levels. Like our liver makes all the cholesterol that we need. It's true that some people have an overactive liver when it comes to making cholesterol, but for most of us, the extra cholesterol coming from our food. So it's important to eat the high fiber because it can help it binds to the cholesterol in the bloodstream. And the bloodstream so that cholesterol binds to the fiber and then the body just flushes it away. Also, the low-fat diet stops the contribution of all that fat in your diet. As well, the blood glucose, if you're not eating fat and sugar, those two things together, the refined carbohydrates and the fatty foods especially, are what really elevate the blood glucose. So if you have found this to be interesting and intriguing, we have Jumpstart 360 programs coming up for you. And you can go to our website, wfeh.org. Go to our website and check out the schedule of upcoming Jumpstarts. And go ahead and register. We would love to teach you more about how to lower those lipid numbers and glucose numbers, and alongside, if you're looking to lose weight, those are the things that we can help with. Take care. Thanks for joining us.